Breastfeeding. Before you show us breastfeeding, the issue that women do not want to breastfeed because their breast may sag.
Yeah.
Is that true? And if it's true, okay, just explain that to us.
So first of all, what changes our breast muscles is not breastfeeding, it is pregnancy. So whether or not you breastfeed, your breast will change because they grow.
So it's a lie?
It's a lie. It's a myth.
So whether I breastfeed or not?
Yes, they will change. Your breast will, the fact that you got pregnant, they will change. Secondly, gravity will work its way as you age. So, I always tell, okay, not to say badly, but if you look at women who've not given birth before and women who've given birth in their 60s, our breasts all look the same, whether or not I breastfed.
Oh.
Because gravity, age will make our muscles drop. So you would rather just nurture your child. What we say is, nowadays there are very many great bras. Use the right bra so that you support, even during pregnancy.
The secret is now in the bra.
Yes, in the bra. Right from pregnancy, because some people will not use the right bra when they're pregnant. So the muscles, you see, because they're heavy, the breasts become heavy as the ducts mature and all that. So you need a good bra that gives you good support so that during pregnancy and the after, you are, as the milk comes in and the breast is heavier, you're holding them up. So please, breastfeed your children.
Boniface, as a registered nurse, tell me other secrets.
The thing is that, first things first, yes, breastfeeding will never make a breast sag, okay? Pregnancy will make a breast sag. Because actually from, when you look at it from around 3 to 4, actually from around 4 to 5 months, you've already started having breast changes. And these breast changes will go on all the way to 9 months, okay? That will be 40 weeks. So that means you actually have like around 4 or 5 months of purely your breast enlarging, okay? And unfortunately, there's nothing you can do about that, okay? And the thing is that, yes, sagging will always come in with gravity on its own self. So a good firm bra, okay, that is comfortable for you, okay, during time of pregnancy, during the time of breastfeeding, okay, will help with that.
Question.
Okay? Yes.
Do you support implants?
Are
they okay? Like after you've had your child and you breastfeed, can women get implants?
Yes,
is that okay?
Now, the thing is that if they're comfortable with them, but the thing is that now, unfortunately, once you get implants, then you'll not breastfeed.
You cannot breastfeed.
Again.
So, yes, because you interfere with the ducts, because you see they have to cut, so they interfere with how the ducts
So probably after you finish the whole bath, you can go for
a
breast implant because the situation
But then again, you know, the other thing is that all of them, they're surgeries that are going towards your chest. They actually risk involved
they carry
around.
Great risks.
Involve the quality of implant being used. If probably it's a low quality implant, it bursts inside.
You know, guys, that's a conversation for another day. We'll do pros and cons. At least, let's talk about the breastfeeding now.
Yeah. So the first thing is, as he said, is put your baby on the breast immediately after birth.
The golden
hour. That just stimulates the breasts. Your brain it tells the brain, come on, this person is out here.
Yes.
We need to make milk. The second thing is that positioning is very important. The greatest complaint that most women say is that it is so painful to breastfeed. And I tell them it is painful because you're holding the breast badly.
Or even the way you hold?
Yes. So first of all, you need to hold the breast like this, like with a C, and not like this. Because that's what you see women doing. Because what you do this, you're actually pulling back the areola. And so when I put my baby will get very little and they'll end up on the nipple. Now the nipple is the most sensitive part of the breast.
Yeah.
And then the ducts are not around there. The ducts are actually behind here. So we need the baby's mouth to come and cover most of the whole nipple and most of the areola.
Right.
For Africans, we have big areolas, so sometimes they can't take the whole areola.
What about for women who have small areolas?
So if they have small, then the baby should take all of it. Yes. So what we want to do is positioning. So we hold it like this. And then I'll take my baby. So my baby has to face their food.
Yes.
So you find people breastfeeding, the head is like this, and it's like this. So that's equivalent to me breastfeeding like this. So what happens? My neck muscles are tired. I will not have a good suckle because I don't drink like this. I drink like this. Yeah. So I face my food. So the same thing, my baby has to face the food. So turn the whole body to face.
Oh, the whole, not just the head, not just the neck,
not just the neck.
Entire
you
body.
Turn the whole body like that. And then now I will come and help my baby. So most newborns tend to they're wondering, what am I looking for? So I want my baby to completely turn like that, and I will help them come and take the whole areola in, and you can even do it's like a sandwich, call it a sandwich, push it so that now this protrudes forward so that the baby can get the whole, when the baby opens their mouth, they can get the whole areola.
Oh, wow.
So once the baby is feeding, and it should not be painful, the baby will feed for as long as they need to. It's on demand, yes?
Right.
So we don't count the clock. We don't look at the clock and say, okay, 10 minutes, that's it. Some babies will feed for 20 minutes, 30 minutes. Once they're done, change them and put them in the opposite one.
Oh,
yes.
wait, when they're done breastfeeding on one side, you
yes.
put, but what if they're full?
If they're full, that's fine.
How do you know when they're full?
They will come off the breast. They just come off and they look happy. They're nice. They look almost drunk.
They have that glow.
That glow, like, I'm done. If they're not full, and usually that's how you know, when they come off once, sometimes because the flow has reduced, the milk in that breast has reduced a bit, and some babies like that flow.
Right.
When they come off, then they start looking for the breast again, because they have all these rooting reflexes telling that they need to feed. So then that tells you, okay, maybe they need to feed some more. I put them. So it's on demand. Feed for newborns, sometimes some babies are sleepy, so they sleep and forget to wake up to feed. So for newborns, we say every 2 to 3 hours, especially if your baby was below 3 kilos, you need to actually wake them up at least after 2 hours to eat.
Wow.
Because sometimes the very small one tends to be lazy, so they can't sleep. But as the child grows older, they'll want to feed. So the first thing I tell parents, trust me, your baby will need to feed every 2 to 3 hours in at least the first 2 months of life. So you need to prepare yourself. You need to organize your life so that in those 3 hours, are you able to get rest in between? Because you will have to wake up to breastfeed your baby.
Boniface, is it wrong, especially if the baby is, let's say a month, or it's just a few days old, or a month, 2 months, to then substitute breast milk or my breast for the bottle?
If the baby's...
if the baby's still a few months, not even months, let's say the first month.
Now, the thing is that...
Because you see mothers pumping.
Yes.
Yeah.
Yes.
So is it okay?
So the first month, we don't give the bottle because it will cause what we call nipple confusion.
Yes.
The mechanism of removing milk from a bottle is different from the breast. Babies are naturally lazy. If you give them a bottle, they'll say, this breastfeeding is hard work, I don't.
Yeah.
I prefer the bottle. And then they refuse to breastfeed. And what did we say? If the baby is not breastfeeding, you won't make enough milk. So we want the baby to be a bit older, maybe at around 2 months, going towards 2 months. Yeah. That's when you can introduce, and you're also preparing to go back to work. So you're teaching the baby that, there are other forms of feeding.
Yeah. So that you can add to that.
Yeah, so the thing is that, it's quite true what she's saying, that if you're going to do it in less than a month, most of the time babies will always get confused. The reason as to why I'm getting confused is, one, I have a softer nipple, okay? Then you're giving me something that's a little bit hard. And then number two, this other one, I tend to actually exercise a bit more. Well, notice that babies, when they breastfeed, they sort of like sweat a bit.
Yeah,
okay?
yeah.
And then now you're giving me a bottle where I just do, and then a whole gush comes in. A whole gush comes in. So I'm like, okay. So, but the taste is the same. So what is happening? Okay?
What is the difference?
Yes. Okay. So the thing is that, yes, it's quite important at least give them a couple of months, at least 3 to 4 months up or there. Then you can actually now introduce your bottle. Okay. But then again, as well as I mentioned, hygiene as well will also be very important when you're actually introducing bottle feeding to the babies. So make sure actually how you clean your bottles, how you store your bottles, very important.
Oh wow.
Okay. Yes, very important.
Okay.
Yes.
All right. Is there anything that you'd like to add now as we close up?
Maybe you'd want to mention about, because sometimes you may actually have challenges with breastfeeding, especially with anatomical issues in terms of inverted nipples and all.
So some people's breast, they are inverted, meaning that the nipple is not out like this.
Yeah.
It is like flush to the body. So those need a bit more extra help. We've got lactation specialists that can help you, but usually what it means is that you might need you might need sometimes to use a syringe to help pull out the nipple before you put the baby on, or you can use now what we call the sandwich hold, where it makes it protrude, and you make sure the baby gets a big chunk of the breast to be able for the baby to pull it out. We've got stuff like engorgement. Engorgement is when your milk your baby is not breastfeeding as fast as the milk is being made. So your breast becomes hard like a stone, and it's painful. So you just need to express that milk, get that milk out. Home remedies are like cabbage. You put a leaf of cabbage in the fridge for a few minutes, and then put it against the skin. So cabbage leaves have enzymes that help to soften.
Oh, wow.
Not any wound. If you have a swollen,
Just take cabbage.
the leaf, and put it against to reduce inflammation. So it helps with breastfeeding, but you just need to express that milk and remove it. If you express, don't pour the milk, store it, because your baby can use it later when you introduce the bottle.
Okay.
Yeah.
The other thing that's to mention about the engorgement, we tend to actually get a lot of patients coming in with what we call mastitis.
Yes.
Mastitis is basically an inflammation around one of the ducts that gets blocked, okay? Then once it gets blocked, pus fills in and all that, okay? So I find that women who actually don't express and start getting engorged breasts are actually at a higher risk of getting mastitis, which is an infection around your breast,
Right.
which sometimes can be ugly in terms of you need to go to somewhere, they incise, they remove the pus and all that. And then the thing is that you may not really use that breast for breastfeeding for a while, okay? So it's quite important that if the baby is not getting out enough, express it out, store it. And the thing is that you can store it for a very long time.
Oh my goodness.